Okay, so this is to welcome Dr. Elisabet Cairó, who's asking how can we strengthen the promotion of public health in EU external relations? Elisabet, the floor is yours. Thank you.
Thank you very much, Mary, for the invitation. I am very happy to be speaking today about what is actually the result of my PhD thesis, which was published as a monograph in July 2021. In my thesis, I looked at the role of the European Union at promoting public health in its external relations. So the role of the European Union as a global health actor. I was interested in this question because EU public health has strongly evolved over time, from barely having any provisions at all in the treaties to being one of the essential aspects of the internal market, and then having one specific provision on public health in what is now Article 168 TFEU, and one specific right to healthcare in the Charter of Fundamental Rights of the European Union, as well as several others health-related rights in the Charter. So the question was whether this gradual evolution of EU public health had also involved a strengthening in the role of the European Union as a global health actor, evaluating how effective the European Union is as a global health actor, and trying to propose measures to strengthen that role. In my examination, I realized that the EU as a global health actor is limited by a number of constraints, some of which are internal and other are external. Internally, the main problem of the EU in public health comes from the fragmentation problem. And this fragmentation results both from EU powers and from the complex institutional framework that we have in EU public health. Regarding EU powers, Article 168 TFEU generally provides a support competence for the Union in public health matters, with the 3 exceptions provided for in paragraph 4. However, EU public health powers are actually much more extensive than what is indicated by this provision, as the European Union often uses alternative legal bases, notably Article 114 TFEU on the internal market, to legislate on public health matters. And for example, all EU tobacco control legislation has been adopted on the basis of Article 114 TFEU. This approach has been repeatedly upheld by the Court of Justice of the European Union, and while it has allowed for the adoption of a lot of health-related legislation, it has also resulted in a legislative fragmentation, since we have some instruments that are only coordinating instruments adopted on the basis of Article 168 TFEU, whereas in cases where the Union has been able to make a link between public health and another EU policy, we can have harmonizing legislation. Regarding the public health institutional framework, I observed that this is a very complex one, which is essentially due to 2 main reasons. The first one is that since public health is generally a support competence, the role of member states will be extremely important in this area. Therefore, in order to coordinate national measures, national public health measures, a number of organisms, informal bodies, and so on needed to be established. This is very visible in Decision 1082-2013 on cross-border health threats, which provides for numerous agencies, organisms such as the Health Security Committee, but also other informal networks for the exchange of information and so on, that would allow for coordinating national positions, exchanging information, and sharing data. The second reason for this complexity is that public health is a very technical area, where scientific knowledge is needed in order to adopt policy decisions. Therefore, the European Commission has established several EU agencies that will advise the European Commission on certain public health decisions to be adopted. So we can mention here the European Centre on Disease Prevention and Control, the European Medicines Agency, the European Food Safety Authority, but of course, many others as well. These 2 internal constraints lead to, as I said, a very strong fragmentation that make it difficult to analyze EU public health in a comprehensive manner and that often oblige us to look at it on a case-by-case basis. This difficulty is all the more important when we look at the role of the EU as a global health actor, because to these internal constraints, we have to add external ones. Externally, there are two sorts of difficulties that arise. One difficulty is legal, and the other one is rather political or diplomatic. Legally, the difficulty comes because of the status of the European Union in health-related international organizations or agreements. So for the EU to promote public health at the global level, it will usually do so through international organizations or agreements that discuss about public health issues. However, the EU participation in such organizations or agreements does not only depend on the EU powers in the area concerned by such organization or agreement, but it will also depend on international law, whether the charter of the constitutive charter of the international organization or the international agreement itself allow regional organizations such as the European Union to become contracting parties or to become full members to that organization or agreement. And here we find a variety of situations. For example, the European Union only holds an observer status at the World Health Organization, which is a state-centered organization. However, it is a full member of the World Trade Organization, which also deals with many health-related discussions in terms of intellectual property rights or sanitary and phytosanitary measures, for example. This heterogeneous status of the European Union in international institutions will also result in a varying degree of influence at the global level. In addition to this, we need to add a more political factor, which is that when the European Union is promoting public health at the global level, it is doing so in the framework of international negotiations with the rest of the international community, where all parties have very different priorities or not. So depending on whether the international community converges or diverges in terms of their public health priorities, it will be easier for the European Union to fully promote its public health standards, or it will need to limit itself to just protecting the most essential red lines in terms of public health protection. All these difficulties, as I said, lead to very different results depending on the specific public health area that we are examining. Let me give you two examples. I will give a more successful example and a less successful one, just to illustrate these points. The first example is the promotion of tobacco control legislation during the negotiations of the Framework Convention on Tobacco Control. During these international negotiations, the European Union played a leadership role that has been taken as an example very often of the role that the European Union can play in global health. This leadership was the result of several factors. First, at the time where the negotiations started, the European Union had already a strong competence in tobacco control legislation and a strong expertise in that area. The Union had already adopted extensive tobacco control legislation, and the validity of this legislation had been upheld by the Court of Justice of the European Union at the time. Moreover, although the European Union only holds an observer status at the WHO, the Framework Convention on Tobacco Control, which was negotiated under the auspices of the WHO, incorporated what is called a REIO clause, a Regional Economic Integration Organization clause, allowing regional organizations such as the European Union to participate and conclude the Framework Convention on Tobacco Control. So the European Union was able to fully participate in the negotiations and then to ratify this international agreement. Moreover, the negotiations of the FCTC occurred with a strong convergence among parties. Most of the parties in these negotiations converged in their willingness to obtain a strong international instrument to combat tobacco consumption. All these factors facilitated that the Union could play a very strong role during these negotiations, and actually some of the provisions of the FCTC are almost identical to some of the provisions contained in EU tobacco control legislation at the time. The second example, which is quite different, is on the role of the European Union in the global fight against cross-border health threats or public health emergencies. In this area, the European Union only holds a support competence under Article 168 TFEU. The only instrument that has been adopted under EU law in this area is Decision 1082/2013, which, as I said previously, is mainly a coordinating instrument among member states. Moreover, international negotiations on cross-border health threats are also organized through the WHO, and the only international agreement that exists so far in this area are the international health regulations. However, the international health regulations only admit states as contracting parties. So the European Union was not able to ratify this international agreement. It was allowed to participate in the negotiations, but its role during the negotiations has been described as very weak and as essentially consisting of coordination meetings before the international meetings with EU member states to coordinate the national positions. So even though the parties in the international community usually meet with quite converging interests in this area, the role of the European Union so far has been rather weak. However, with the opening of negotiations for an international pandemic treaty, the European Union now has a new opportunity to try to strengthen its role in this global debate and strengthen its position in this public health area. What we see from these two examples is very different situations depending on the factors that we take into account. Therefore, I believe that the main problem right now for the European Union to play a strong role in global health is that it is a very fragmented actor that cannot play a uniform role among all public health areas. Therefore, in my thesis, I looked at different measures that could result in a more comprehensive approach to EU public health. Here, I will make three proposals which seem to me like the most important ones. The first one, related to EU powers, would be revisiting EU public health powers. EU public health powers, as they stand right now under Article 168 TFEU, are not in accordance with the broad public health objectives that are stated in the treaties, both under Article 168 TFEU and under Article 9 TFEU. And they are not in accordance either with actual developments in legislation and in the case law. For example, Article 168, paragraph 5 states that the Union can only adopt incentive measures on tobacco control, but we know that we have actually harmonizing directives in tobacco control on tobacco products and tobacco advertising, for example. Therefore, it seems that this provision should be adapted to current developments, actual developments that have been upheld as being valid by the Court of Justice of the European Union. Here, there could be two different approaches that could be adopted. The most restrictive one would be to simply update Article 168 TFEU with legislative developments that have already taken place. For example, adding tobacco control legislation among the areas of shared competence where the Union can adopt harmonizing legislation. This would be an easier modification because we wouldn't be bringing anything that hasn't already happened in EU law. However, it wouldn't solve the fragmentation problem, and it would also mean that Article 168 TFEU would need to be regularly updated whenever there is any new development in EU law. Under a broader approach, we could simply remove the the prohibition of harmonization under Article 168 TFEU, although providing some exceptions to it, for example, for healthcare services. This would allow a more comprehensive approach to public health. It would be more coherent with public health objectives, and it would provide more stability. The problem would be, of course, reaching political consensus to undertake such a strong treaty reform. However, we have to keep in mind that 2 out of the 3 exceptions that are provided under Article 168, paragraph 4 TFEU were actually incorporated following as an important public health emergency. So the current pandemic could actually provide the perfect opportunity to revisit this provision and look at whether a modification is necessary. Moreover, an increased public health powers have actually been requested recently by the European Commission, the European Parliament, some member states such as France or Germany, and it has also 2/3 of EU citizens have also stated that they would agree with such a change in accordance with the last EU barometer. The second measure would be related to the status of the European Union in selected international organizations and agreements. As I said at the beginning, the European Union holds very different statuses in all health-related organizations and agreements. So the European Union could undertake an examination of all organizations and agreements that deal with health-related matters and explore in which of them it would be interesting to request an enhanced status. Of course, the first organization that comes to our mind is the World Health Organization. However, requesting the full membership at the WHO would require a modification of the WHO Constitution, and therefore a 2/3 vote of the World Health Assembly. And this seems currently difficult to achieve. However, the European Union could still strengthen its status at the WHO without reaching the full membership status by asking, for example, access to confidential information, to fully participate in debates, and therefore to have all rights associated to membership except the right to vote, which is considered under the World Health Assembly Rules of Procedure as an associate membership. An alternative to this would be not to upgrade the status of the European Union at the World Health Organization itself, but to look for an upgraded statuses in agreements negotiated under the auspices of the WHO, as the Union did with the Framework Convention on Tobacco Control. And here, the upcoming negotiation of the International Pandemic Treaty constitutes a very good opportunity, since it is still unclear which legal instrument will be used for these negotiations, but it could be an opportunity for the European Union to negotiate its full participation in the negotiations and its ability to ratify the final agreement. Lastly, I think that a more comprehensive approach to public health could also result from a clarification of the relationship between public health and general objectives and principles. And this relationship goes in 2 different directions. First of all, we could strengthen the position of public health as a general objective of the European Union. For now, public health is only mentioned in Article 9 TFEU, but the status of this provision in a dispute remains unclear. Public health is not mentioned among the values of the European Union, and with regard to the role of the European Union as a global health actor, public health is not mentioned either under Article 21 TEU on the objectives of the EU external action. A reference to public health under Article 21 TEU would ensure that any international negotiations undertaken by the European Union take full account of public health. And these would be, for example, very important in terms of trade negotiations. References to the environment or sustainable development are included in Article 21 TEU, but no reference to public health has been incorporated to this provision. On the other hand, I also believe that it would be useful to define some guiding principles that should guide all EU public health actions in a similar way to what has been done in the EU environmental policy. some principles that should, of course, be incorporated as guiding principles in EU public health would be human rights or the precautionary principle, which have already been admitted by the Court of Justice of the European Union. However, we should also think about other principles such as solidarity or sustainable development, for example. I believe that having a more clear relationship between public health and general objectives and principles could really help into examining public health in a more horizontal manner, and therefore having a proper, comprehensive EU public health policy. So these are the 3 proposals that I wanted to make today. I guess some of them will lead to some discussion, so I'm looking forward to your questions, and I thank you very much for your attention.
Thank you very much, Elisabet. I'll just stop the recording.